Question 1. Which action should the nurse take first when a patient with stroke becomes acutely hypertensive? A. Recheck the blood pressure in 15 minutes. B. Call the rapid response team. C. Assess for signs of increased intracranial pressure. D. Administer the prescribed antihypertensive. Answer. C. Assess for signs of increased intracranial pressure. Question 2. The nurse notes that a stroke patient has neglect syndrome. What is the best nursing intervention? A. Encourage the patient to focus only on the unaffected side. B. Place objects on the unaffected side of the body. C. Frequently remind the patient to scan the affected side. D. Keep the bed rails down to promote independence. Answer. C. Frequently remind the patient to scan the affected side. Question 3. A stroke patient has a right-sided weakness. Which side should the nurse place the chair during transfer? A. Right side. B. Left side. C. Any side is acceptable. D. Directly in front of the patient. Answer. B. Left side. Question 4. A patient with stroke is showing signs of increased intracranial pressure. What should the nurse do first? A. Lower the head of the bed. B. Call the healthcare provider immediately. C. Administer morphine for headache. D. Give a bolus of 4 fluids. Answer. B. Call the healthcare provider immediately. Question 5. Which task is most appropriate for a nurse to delegate to a UAP for a stable post-stroke patient? A. Feeding a patient with swallowing precautions. B. Assisting with bathing and hygiene. C. Teaching about stroke prevention. D. Evaluating level of consciousness. Answer. B. Assisting with bathing and hygiene. Question 6. Which of the following is a typical symptom of a left hemisphere stroke? A. Impulsive behavior. B. Visual spatial deficits. C. Difficulty speaking or understanding language. D. Poor judgment and denial of deficits. Answer. C. Difficulty speaking or understanding language. Question 7. Which nursing intervention helps prevent contractures in a stroke patient with hemiplegia? A. Keep the affected limb in a flex position. B. Encourage bed rest for muscle healing. C. Perform passive range of motion exercises. D. Avoid use of splints during the day. Answer. C. Perform passive range of motion exercises. Question 8. A stroke patient is having difficulty swallowing pills. What is the nurse's best action? A. Crush all medications and mix with food. B. Notify the provider and request liquid formulations. C. Instruct the patient to take pills with large sips of water. D. Delay the medications until later. Answer. B. Notify the provider and request liquid formulations. Question 9. Which clinical finding is most concerning for a stroke patient receiving thrombolytic therapy? A. Mild dizziness. B. Redness at foresight. C. Bleeding from gums. D. Numbness in extremities. Answer. C. Bleeding from gums. Question 10. A patient with expressive aphasia post-stroke becomes agitated during communication. What is the best response? A. Try to speak more clearly so I can understand you. B. Take your time, I understand this is frustrating. C. Let's try again later when you're less tired. D. Just write it down instead. Answer. B. Take your time, I understand this is frustrating. Question 11. What position should the nurse place the stroke patient in to reduce aspiration risk during feeding? A. Supine with pillow support. B. Left lateral side lying. C. Upright at 90 degrees. D. Semi-Fowlers with chin up. Answer. C. Upright at 90 degrees. Question 12. Which action is most appropriate to include in the care plan of a patient with stroke and impaired mobility? A. Encourage ambulation without assistance. B. Perform all ADLs for the patient. C. Use assistive devices during movement. D. Limit mobility to conserve energy. Answer. C. Use assistive devices during movement. Question 13. A nurse suspects a patient is having a transient ischemic attack, TIA. What is the priority? A. Administer aspirin 325 milligrams. B. Notify the healthcare provider immediately. C. Perform a neurological exam every 4 hours. D. Reassure the patient and monitor symptoms. Answer. B. Notify the healthcare provider immediately. Question 14. The family asks why the patient isn't receiving TPA 10 hours after symptom onset. What is the best explanation? A. The medication is not effective after 6 hours. B. The stroke is not serious enough to need it. C. It's only given to younger patients. D. There was no consent given in time. Answer. A. The medication is not effective after 6 hours. Question 15. What is a key nursing action after administering TPA to a stroke patient? A. Encourage active physical therapy. B. Monitor closely for signs of bleeding. C. Increase the 4 fluid rate. D. Suction the airway every hour. Answer. B. Monitor closely for signs of bleeding. Question 16. Which instruction is most appropriate for a stroke patient with homonymous hemianopia? A. Look straight ahead at all times. B. Turn your head to scan your environment. C. Avoid reading books or newspapers. D. Only use your dominant eye for visual tasks. Answer. B. Turn your head to scan your environment. Question 17. What dietary modification is best for a stroke patient at risk of aspiration? A. Clear liquids. B. Thin liquids and soft solids. C. Thickened liquids and pureed foods. D. Regular diet with small bites. Answer. C. Thickened liquids and pureed foods. Question 18. A stroke patient is reluctant to participate in rehabilitation. What is the nurse's best initial approach? A. Explain that rehab is mandatory for discharge. B. Call the provider to adjust medications. C. Explore the patient's fears and goals. D. Contact social work for discharge planning. Answer. C. Explore the patient's fears and goals. Question 19. Which finding indicates effective treatment in a stroke patient at risk for aspiration? A. Decreased oxygen saturation after meals. B. Moist lung sounds on auscultation. C. No coughing or choking during eating. D. Presence of food particles in oral cavity. Answer. C. No coughing or choking during eating. Question 20. What should the nurse do when a stroke patient becomes drowsy and confused after TPA administration? A. Encourage fluids. B. Increase activity level. C. Elevate the legs. D. Notify the healthcare provider immediately. Answer. D. Notify the healthcare provider immediately. Question 21. What is the nurse's best action when a stroke patient shows signs of unilateral neglect? A. Perform all tasks for the affected side. B. Instruct the patient to ignore the affected side. C. Teach the patient to use the affected limb more. D. Encourage the patient to turn their head toward the affected side. Answer. D. Encourage the patient to turn their head toward the affected side. Question 22. A stroke patient with dysphagia is scheduled for oral medications. What is the priority nursing action? A. Administer all meds crushed with applesauce. B. Check for a recent swallow evaluation. C. Ask the family to give the meds. D. Give meds with water and supervise. Answer. B. Check for a recent swallow evaluation. Question 23. Which is a priority nursing diagnosis for a stroke patient with right-sided hemiplegia and aphasia? A. Risk for impaired skin integrity. B. Impaired verbal communication. C. Risk for aspiration. D. Social isolation. Answer: C. Risk for aspiration. Question 24. Which statement by a caregiver of a stroke patient indicates a need for further teaching? A. I will help him dress the weak arm first. B. We've installed grab bars in the bathroom. C. He'll be independent again in a few days. D. We plan to attend all rehab sessions. Answer: C. He'll be independent again in a few days. Question 25. What assessment findings should the nurse report immediately in a patient post-stroke? A. Blood pressure of 138/88. B. Inability to move the left leg. C. Slurred speech and unequal pupils. D. Mild right-sided weakness. Answer: C. Slurred speech and unequal pupils. Question 26. Which action by the UAP requires intervention by the nurse in stroke care? A. Elevating the head of the bed during feeding. B. Ambulating the patient with a gait belt. C. Assisting the patient to reposition every 2 hours. D. Placing food on the weak side of the mouth. Answer: D. Placing food on the weak side of the mouth. Question 27. Which intervention best supports emotional adaptation in a stroke patient with loss of independence? A. Allow choices during daily care. B. Schedule all activities without patient input. C. Provide total care to minimize effort. D. Avoid discussing long-term goals. Answer: A. Allow choices during daily care. Question 28. What is the priority nursing action after noting sudden lethargy in a stroke patient? A. Take a complete health history. B. Monitor blood glucose levels. C. Notify the healthcare provider immediately. D. Administer prescribed sedative. Answer: C. Notify the healthcare provider immediately. Question 29. Which statement by the patient recovering from stroke indicates understanding of fall prevention? A. I can walk alone if I feel steady. B. I'll wait for help before getting up. C. I don't need shoes when walking in the room. D. I can use a chair with wheels for convenience. Answer: B. I'll wait for help before getting up. Question 30. A stroke patient with expressive aphasia is struggling. What tool would best assist communication? A. A translator. B. Flashcards or a picture board. C. Notepad and pen. D. Audio recordings. Answer: B. Flashcards or a picture board. Question 31. What should the nurse emphasize during teaching for stroke prevention in a hypertensive patient? A. Eat large meals for energy. B. Monitor blood pressure regularly. C. Increase daily salt intake. D. Avoid all medications during stress. Answer: B. Monitor blood pressure regularly. Question 32. Which behavior suggests a patient with right hemispheric stroke may need extra safety measures? A. Verbal communication is impaired. B. The patient is impulsive and unaware of limitations. C. The patient avoids speaking to staff. D. The patient needs assistance with memory recall. Answer: B. The patient is impulsive and unaware of limitations. Question 33. What is the most appropriate nursing intervention during the acute phase of stroke? A. Encourage fluid intake. B. Administer acetaminophen. C. Maintain airway and oxygenation. D. Increase stimulation to promote alertness. Answer: C. Maintain airway and oxygenation. Question 34. What position promotes optimal cerebral perfusion in a patient post-stroke? A. Supine with legs elevated. B. High Fowlers with head turned to the side. C. Head of bed elevated 30 degrees. D. Prone with neck extended. Answer: C. Head of bed elevated 30 degrees. Question 35. A patient recovering from stroke states, "I'll never walk again." What is the nurse's best response? A. You're right. Stroke recovery is unpredictable. B. Let's talk with Rehab about your progress so far. C. You just need to try harder to get better. D. That attitude won't help your recovery. Answer: B. Let's talk with Rehab about your progress so far. Question 36. What is the primary goal of rehabilitation for a stroke survivor? A. Complete return to previous function. B. Acceptance of permanent disability. C. Maximizing independence and function. D. Learning to live with total dependence. Answer: C. Maximizing independence and function. Question 37. Which nursing action is most appropriate to prevent deep vein thrombosis in a stroke patient? A. Keep legs elevated above the heart. B. Encourage early ambulation as tolerated. C. Massage the legs twice daily. D. Limit leg movements to conserve energy. Answer: B. Encourage early ambulation as tolerated. Question 38. What is the nurse's priority when a stroke patient complains of a sudden, severe headache? A. Offer a cool compress. B. Reassure and dim the lights. C. Evaluate neurological status and report findings. D. Administer prescribed pain medication. Answer: C. Evaluate neurological status and report findings. Question 39. A stroke patient is crying during therapy sessions. What is the best nursing intervention? A. Tell the patient to be strong. B. Encourage verbal expression of feelings. C. Distract the patient with activities. D. Report emotional lability to the physician immediately. Answer: B. Encourage verbal expression of feelings. Question 40. Which observation by the nurse indicates improvement in a stroke patient with mobility deficits? A. The patient uses a walker with assistance. B. The patient requires total help with transfers. C. The patient refuses to engage in PT. D. The patient avoids moving due to fear of falling. Answer: A. The patient uses a walker with assistance. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!